The coronavirus disease spread rapidly across the world, so that on March 11, 2020, the WHO characterized it as a pandemic. States are struggling to avoid the spread of the disease within their borders. The situation is even more complex in countries, which have been weakened by years of protracted conflicts, as it is the case of Iraq. Iraq experienced armed conflicts and the occupation of vast regions by the so-called Islamic State, which resulted in vast population displacements, particularly to the autonomous region of Iraqi Kurdistan. Iraqi Kurdistan has become a safe haven for many. While several countries reacted slowly to the coronavirus pandemic, the reaction of the Kurdish authorities, and of the Ministry of Health, was prompt. Neighboring on Iran, Iraqi Kurdistan was among the regions considered at high risk for the spread of COVID-19. Therefore, the Kurdistan Regional Government put in place a wide range of preventive public health actions.
In Kurdistan region, Ministry of Health, we started first measure in 23rd January in the beginning of the current year with implementing of a high committee for the preventing of coronavirus. In the preventive department of all the general directorates, we implemented several teams for surveillance team for detecting the cases or suspected cases for the COVID-19. Now we entered a new phases or a new peak of the coronavirus spreading in everywhere in Kurdistan region. Currently we ask all the NGOs and donors, even UN agency, to provide more medical supply and to support and to help Kurdistan region because we are suffering from several crises. We appreciate His Excellency Prime Minister that he decided and provided several times a special budget. However, we are suffering from the economic crisis in KRG, but he focused on the coronavirus. He have a good attention to prevent such pandemic in Kurdistan region.
On February 25, before the detection of the first COVID-19 case, a health emergency was declared. In a region where the median age of the population is 21, the first decision was to close nurseries, schools, and universities on February 26. This action was followed by a recommendation to limit large gatherings, which was later changed into a compulsory ban including religious celebrations, entertainment, business meetings, as well as civil and sport events. Also Nowruz, the Kurdish New Year celebrations have been cancelled. It has been the strongest sign, affecting the Kurdish identitary feeling. All non-essential governmental and private sector activities were suspended, shops and cafes included. People involved in essential sectors, electricity, water, communications, etc., are still working. All public transports have been suspended since March 13. A night curfew was enforced in the whole region. Travel restrictions and quarantines for travelers arriving from other countries have been introduced as well. Sanitary cordons prohibiting exit and entry in areas of active contagion have been implemented around villages where subjects were tested positive to SARS-CoV-2. In order to reduce hospital overcrowding, as well as to prevent vulnerable people from leaving home, an emergency hotline was reserved for suspected COVID-19 cases and for patients requiring hospital care. At the hotline, they receive calls and take note of the client's medical history, so that mobile teams can be dispatched to visit suspected COVID-19 cases at home.
The number of people who put in quarantine from the beginning were 3,777. And the number of the tests done for the people who were in quarantine and also from the community or from the other governors coming to our government here were 11,688 tests. The number of patients that were diagnosed having coronavirus were 19, and all of them were discharged with good outcome and they were cured from the virus.
The activities of almost all the primary healthcare centers have been put on hold. Some units have been converted into COVID-19 specialized centers. Several public hospitals with intensive care units have been identified as COVID-19 hospitals. Some of these hospitals and primary health centers are health facilities which had already been included among the 59 centers of the Kurdistan Regional Government Health Information System, a project of the Ministry of Health, in cooperation with the University of Rome Tor Vergata and the support of the Italian Agency for Development Cooperation. Lack of public awareness and consciousness fed some irresponsible, despite sporadic, behaviors such as unnecessary movement and mass gatherings. Moreover, large populations straight expressed concern about the economic consequences of the interventions, particularly in a time in which crude oil prices are exceptionally low. The authorities have actively counteracted such feelings by promoting extensive information campaigns on the social media and by meeting the population. University students have been recruited for awareness campaigns. NGOs have set up information and health education campaigns in the refugee camps, which are at higher risk of infection. The director Levin told us in a recent interview, "We'd like to thank all the people for following the measures set by the government, and also big thanks to the medical sector, and the police sector as well, which made all this possible, and managed to have low number of cases in Erbil with their help. Now, after a while of total lockdown, there are some ease for people movements, and markets and government sectors are reopen." So far, some lessons can be drawn from the Iraqi Kurdistan experience for the whole Middle East. First, if the population is exhaustively informed about the reasons of the dictation of public health decisions, it is much more ready to follow the issued guidelines.
We are extremely grateful for this kind of collaboration that WHO and the Ministry of Health are having here in Kurdistan. One of the reasons why this kind of collaboration has been very successful is the transparency and and sharing the information between the two entities.
Second, when a serious public health threat arises, private health structures are not enough to cope with it. As a matter of fact, the private sector, even if useful in treating diseases, does play a very limited role in the field of prevention. Only substantial investments in the public health sector can enhance countries' ability to implement preventive actions and to cope with sudden increased needs in health care. Third, once the pandemic will be over, the setting up of e-health information systems for monitoring health data of the population, at which the Iraqi Kurdistan is already working on, coupled with the development of a culture of using data for decision-making, will be a priority for the region. Implementing epidemiological surveillance as a routine public health practice is paramount to managing complex health situations while preparing for future crises. The Health Directorate of Suleimania is devolving any possible effort in fighting against outbreak episodes, in order to control them and to avoid any further diffusion. The director Azad, from Halabja, told us, "We opened a laboratory specialized for testing coronavirus in Halabja city, so as to test COVID-19 suspicious cases, and we built a COVID hospital for corona cases, thanks to the civil society organizations, charitable people, and all political parties, with 64 patient beds, and more than 8 intensive care beds. We are now prepared for the possibility of second COVID-19 outbreak."